Tánaiste has discussed the issues in relation to the safety measures or lack thereof that potentially existed in terms of Air Corps aircraft maintenance personnel over the course of recent decades. During our last discussion, there were two, I suppose, broad areas that we discussed. One is the court-related issues, and just to flag, in response to the points you made last time, a number of people have said that the engagement with the State's Claims Agency is not anything like it should be, but even separate like that, the need for a policy-orientated response from the Department.
So look, in fairness, Deputy Ó Laoghaire, he put me on notice that he's going to raise this issue on each and every occasion, and quite rightly and understandably, considering the seriousness of it. So let me say a few things. As I've said out previously, and as I am also obliged, I suppose, to set out every time this question is posed to me, I'm somewhat limited, despite the constructive way in which the question is put forward, that any discussions we might seek to have, any comments I make, are necessarily limited in light of the ongoing litigation in respect to this matter currently being before our courts. I have set out that position in this House previously, so there is a limit to what I can say in the circumstances in order to avoid intrusion into the independent role of our courts in respect of these matters. The issue of alleged exposure to chemicals in the Air Corps is, as the Deputy says, subject of a number of litigation cases, the management of which has been statutorily delegated to the State's Claims Agency. I do, though, wish to advise Deputy Ó Laoghaire, while remaining faithful to the limitations that I've set out, my officials have, at my request and following on from our discussions, started to develop preliminary options and have begun a process of the consideration in relation to any possible actions that may inform the general position of those who allege experiencing harm arising from potential chemicals. The initial exercise is underway, it's exploratory, and it does arise from my undertaking to the Deputy during previous oral PQ sessions. I don't want to go into too many specifics at this point, and this is primarily because a considerable portion of the nature and scope of any proposal will need to take account of what can be done without cutting across the current litigation cases and agreeing these limits and appropriate consultation. I would, though, this is not in my prepared answer, but I would be very happy to have a briefing with the Deputy in relation to this and ask my officials to sit down and hear your views and thoughts on this, because there is, as I've said, a challenge in relation to meeting individual people perhaps, but perhaps we could have my officials engage with you in relation to some of your own thoughts on this, because I know they are working to try and make progress. I do want to again draw the Deputy's attention to the point I made during our previous discussion on the matter, that there is an ongoing process of engagement between the State Claims Agency and current plaintiffs, and that I did ask that this be given time and space, and I'd be interested in what you're hearing in relation to that engagement.
Yeah, just on that point, and I understand that there's restrictions on what you can respond to me, but a former member of the Air Corps, a former personnel who was part of the aircraft maintenance. Just to be clear, there is no current active engagement between the State Claims Agency and litigants, despite what the Minister claimed in the Dáil last week. Nobody from the SCA has talked to any survivors since before the settlement of a particular case recently. So I'm asking you to take that away. I know there's limits on what you can say back to me, but I'm asking you to take that away and put that to the State Claims Agency, that there isn't engagement. But even aside from that, and what you said to me, I'm glad to hear that. I'm glad to hear that options are being looked at. In terms of, and I think I have another opportunity here again, it's like, in terms of what we should be looking at, like, it seems to me clear, it's like there are obviously things that need to be worked out, but one of the most fundamental things is a health review, a review and analysis of health outcomes, and subsequent to that or related to that, ensuring that people are not out of pocket because of the healthcare situation that they found themselves in.
So firstly, I will very much take away the point you made and that you read out there in relation to a lack of engagement, because my note tells me that there's an ongoing process of engagement, and clearly both can't be factually true. So I will personally undertake to clarify that with the State Claims Agency, and happy to revert to the Deputy. As I say, my officials have begun an exploratory process to consider what options may be available to me from a policy point of view to consider this issue further. And without straying too far, I mean, where my thinking is at is this. There are legal cases. I'd like all of these resolved in so far as they can be in a constructive manner. But legal cases always require cause and effect and being able to prove cause and effect. Regardless of that threshold, if there are people in our country that have health needs There are examples in the past where we've endeavoured to meet those health needs, separate and distinct to any legal process, and trying to establish cause and effects that people have every right to try to do. And they're the two separate issues that I'm trying to grapple with. And I do think of times in the past, without any admissions of liability, the state has taken actions to try and meet the health needs of some of its people. And that's, I think, something we should explore.
Yeah, look, I mean, I think that is in the area that we need to be looking at. I think there's potentially more than that, but that is one of the crucial areas. And I would say that not only here in relation to other sectors or other categories of people who have had wrongs inflicted on them, and sometimes it's difficult, you know, to put them all through the courts for a variety of reasons, but also internationally. Like, I mean, I have brought this up with you before, that in Australia, in the Netherlands, some of the response in relation to aircraft maintenance personnel, because this is an issue, the self-same issue has risen elsewhere, has been in terms of the healthcare side of things. On what you've talked about, on exploring options, I have two questions. The first is, what kind of timescale are we looking at? I would welcome the opportunity to have a briefing with yourself and some of your officials, but I would also say that it would hardly be appropriate if it was simply members of this House that had that opportunity. I think some representative organisations, I know there's the Air Corps Chemical Abuse Survivors organisation, there are potentially other organisations, and I expect that it would be only right that at some stage in this process that they would have the opportunity to have an engagement.
Yeah, look, when the time is right and when the advice is to me that it's appropriate for me to have meetings, I'm very happy to engage. I obviously have you in a separate and distinct category as the opposition spokesperson on defence for the largest opposition party, and I'm happy to engage with you to see if we can constructively make progress. I will ask that we look, and I have already, at the examples in other jurisdictions that you've referenced in this House. I don't have an exact timeline in relation to this. I'm informed there's significant complexities in relation to this, but perhaps at a meeting and a briefing we could tease through some of this in a bit more detail, and then of course return to this no doubt at the next PQ session as well.